Hello, I'm Dr. Walter Tom, and I am the Medical Director of LaEvita Laser Body Contouring. And what we're going to demonstrate today is our 980 nanometer diode laser, which is an excellent tool in helping us to sculpt the body. Our particular patient today is in excellent shape but has some genetically predisposed areas of fat deposits. We're going to show you how under complete local anesthesia we're going to be able to help to sculpt this with the, again, 980 nanometer diode laser and then with aspiration of the melted fat. We will see skin tightening related to the laser being passed in the subdermal plane. You will see the patient afterwards walk out of our office completely coherent, awake, and happy with her results. What areas are we going to take care of for you today, Candace?
I'm going to take care of the outer thighs.
Outer thighs, okay. What we call the saddlebags?
Saddlebags.
Okay.
And the inner thigh, and then up on the upper hip.
Up on the upper hip. Okay, so we're looking at Candace's outer thigh area and what we call the saddlebag. So that's the area that we're going to look at.
Okay.
All right, very good. So right now I'm holding the LaEvita handpiece, and you can see there's a very tiny 600 micrometer laser fiber, which you can see down here, that has a sheath, and then several millimeters of exposed laser fiber. And that's polished at the end. So I'm going to bring it back so that the sheath portion is just flush with the edge of the cannula. The opening is very tiny, about 3 millimeters, right in here, and you can see that I just placed it right under the skin, and it just goes pop right under the skin. Let's go ahead and let's turn the laser on now. Okay, thank you. Okay, and lights off. Okay, laser on. We're just passing the laser fiber under the subdermal plane and going slowly. We want to just go slowly. Our tendency is to want to move back and forth in a fashion like this. And again, this is going to give her a great butt lift as well as remove this unwanted muffin top or flank area. Okay, so now we've done the subdermal plane, and I'm going to use another 4,000 joules to get into the fatty layer. So I'm going deeper now. So you may or may not be able to tell that the laser aiming beam underneath is not quite as bright because I'm in a deeper plane. And again, the tendency is to move a little too quick, and is to actually slow down and let the laser do the work. So I need to tell myself that constantly, is to slow down and let the laser do the work. So right now all we're doing is melting the fat.
Yeah, that's what I want to hear.
Yes, we are. We're melting the fat for you, okay? So we've now have delivered 8,000 joules to the right flank and 8,000 joules to the right saddlebag area. This is our powered-assisted liposuction cannula. Here we go now. Okay, Sandra and Dee, thank you. We're suction on. We're all set. So now you can see, do you feel anything at all?
No.
Good.
Good, you're doing great.
You're doing great. So right now all I'm doing is just suctioning out the liquefied fat.
Amazing.
And you can see this is the liquefied fat. And you can see here the melted fat has a grayish, dusky look, and that's because that fat has been melted and liquefied. Well, we've just completed Candace's LaEvita laser body contouring, and she's done very well. How are you feeling, Candace?
Feeling great.
Great. Did you have any discomfort with the procedure?
None.
So Candace did great. Once again, we used the LaEvita 980 nanometer diode laser, and with this laser we were able to contour her flanks, her saddlebag area, as well as her inner thigh. And we're very pleased with the results, and in a moment you'll see Candace walking out of our office. Thank you.